Hello, I'm Sean Sang-won Park. I'm a prosthetic urology practicing in Seoul, South Korea. I limited my current practice to the service to the penile implant surgery, especially inflatable. So I started my penile implant practice 2013 November. So it has been about a decade I am in this field. For me, I started training the other surgeons pretty recently. I would say about 5 years ago, I started to train the others. Number one, I wasn't ready to train others. I had to train myself. Number two, when I first started my practice, I was so paranoid. So I didn't want to share my techniques. But my mentor and my father, Dr. Wilson, came to Korea and gave me a really hard time. Why are you not training the others? Why do you act like the others? If you want to be a good surgeon, you're going to be like myself. You want to be better than yourself now, you got to train the others. So you have to follow your father's order. That's why actually I hesitantly started to train the others about 5 years ago. When I first started the training, I thought it is I would say, unidirectional thing. I trained them and that's it. But actually it was not. During the training, I found out that I was getting unexpected questions. Dr. Park, why you do this part? Why are you doing that? Or is there any reason why you have this step? What's the reference of that? All those barrage of the questions gave me a chance to objectively see how I do the surgery. Because we surgeons are usually so, focused and can't really see other aspects of our surgery. It's really hard for us to objectively analyze our surgery. Like a racing horse. You just watch in front of you and just run. But these kind of trainings were able to broaden my field of view and rethink about the way I do the surgery. So unlike what I thought at first, training the other surgeons is a bi-directional. Not only I'm training them, I was learning from them, even though they are my trainees. Whether he is a highly experienced or not, I was learning from them. So in my opinion, training is not for the trainee only. Training is for the trainer as well. I truly believe that if trainer cannot benefit himself during the training, nobody will enjoy the training. So for me, training the others is for myself as well. At the same time, if you train the others, that's a kind of huge joy. They like what you like. So kind of making more friends or having more colleagues or brethren in our field. So this training course is, I'll say this is a renovation of the training of prosthetic urology. In this course, every trainees will be able to join the surgery with us so that they can scrub in, fill the patient, and when they come back to the conference room, they will watch, let's say, scrotal approach from the 5 different surgeons, subcoronal approach from the several different surgeons, infrapubic approach from the different surgeons, which means that they will be able to immerse themselves for about 7 hours of this prosthetic urology courses. We all know that not many do the prosthetic training throughout their residency or throughout their fellowship. But this kind of intensive course, I would say intensive care, will maybe be able to resuscitate their enthusiasm toward the prosthetic urology. So I don't know whether this will be effective or not. That will be decided by the judges, which is the trainees. But I believe this kind of renovation is just amazing. It is done by Dr. Wilson. This just dazzles me. We human beings are animal of habit. Many psychologists say that. I kind of do not like to change what I was doing. But if we keep doing what we were doing, we cannot really advance or make it better. Even in the training, we should think about outside of the box and try something else so that we can do a better training.